Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, we are back, and this is still Healthy Living on KUM News Extra. Now, once again, please welcome Dr. Jitka Lom from Express Care. She's in studio, and she'll take your questions regarding the theme tonight. It is Kids Health, where we focus on tummy aches and growing pains. Ouch. Doctor, welcome back.
Thank you.
Okay, so growing pains for kids. You know, kids have very special and very specific needs health-wise, and their care is obviously a very specialized discipline and everything. What are some of the symptoms of some of the growing pains kids go through as maybe they approach puberty and as their bodies begin to change and as they begin to grow?
Well, it's interesting, Jason. Actually, growing pains occur in really young children, usually between ages 4 and 6 in the early preschool and early school ages. And those tend to be pains that are below the waist, in the legs, below the knee especially, and they happen at nighttime while the children are asleep, and they wake up crying and upset, and of course that upsets parents as well. It's not necessarily related to a rapid growth spurt at all, and tends to go away by the time the children are in their teenage years. So the cause is really not known for sure, but it's very, very common in kids.
Wow, so is it maybe, we can only speculate here because scientists obviously haven't been able to pinpoint and everything, but maybe the formulation of, like the bones or their...
Yeah, there must be something, yeah.
Okay, that's pretty interesting. Okay, what are some of the ways to cure your child? Talking about stomach aches now, it's so often, put in so many different types of media, like in the movies and everything. Oh, mommy, like I have a tummy ache and everything like that. What typically causes sour stomach in young children and everything, and how can you best treat that? Maybe before you get to some of the OTC medicines and everything, just with like common household remedies.
Yeah, it's a very, very common complaint, and children will have sensitivities to foods. As they're getting older, they're trying out new foods all the time, and there may be foods that disagree with them. So in general, if your child has a tummy ache, it's a good thing to not give them any more of that food or any food at all till the stomach settles down. Just letting them rest, drink lots of fluids, sticking with water or Gatorade or Pedialyte rather than fruit juice or soda. Those things would tend to aggravate. And so you would just want to hydrate your child, maybe put a little warm pack on their tummy and let them just rest and see if the stomach ache will go away, because quite often they will. A very common reason for stomach aches in children is constipation, because these days our kids tend to not eat as much fiber as they should, a lot of processed foods, and as a result they'll get a little backed up and get a tummy ache from that. So asking them to try sitting on the toilet may also be pretty helpful.
Well, that's an interesting point, because of course, all of us go through this when we're young, and they're very different types of stomach aches and everything. So scientifically and everything, what exactly makes the stomach hurt in different areas? You said it might be constipation, maybe it can be gas, maybe it can be,
We can even have bacterial overgrowth. It's normal to have healthy bacteria in our colon. Sometimes there may be too much of the wrong kind of bacteria depending on what we've been eating, especially a lot of simple carbohydrates, sort of like, again, cakes, cookies, pasta. Those kind of foods will tend to promote the growth of unhealthy bacteria. So encouraging your child to eat lots of fruits and vegetables, at least 5 a day, would be very helpful.
Now, of course, you talked about some of like the simple, remedies, like you said, just tell your kid to kind of like, keel over and kind of like, ride the wave, for lack of a more appropriate term and everything. But at what point should parents actually seek medical attention?
Well, of course, if the child is having other symptoms associated with it, like vomiting or diarrhea, or if the pain is very severe, or especially if they have a fever with the pain, then they should be evaluated. The thing we always worry about, of course, is appendicitis in a small child that may not be able to verbalize what's really going on with them.
Yeah, stomach aches in very, very small children. It's like, how do you deal with that as a physician?
Yeah, it's sometimes very challenging. Doing blood tests and having an ultrasound done is helpful. Observing the child for a period of time, either at home or in the hospital, is sometimes necessary, and consultation with a surgeon sometimes as well.
Okay, very well. Well, I'll tell you what, Doctor, we do have a lot of questions that we want to get to. It's been a really good week as far as audience participation, so we'll get to those in just a moment. Well, stay tuned, my friends. KM News Extra and Dr. Lom continue. Your questions coming up right after the break.